Okay, so I'm Dr. Vicki Kelso, and this is Peppy, our clinic cat, one of our clinic cats, and we're going to talk about giving a cat an exam today. And the reason that we're talking about that is because the exam is actually the most important part of the whole veterinary visit. Veterinarians obviously can't ask the cats what's wrong with them, and so what we have to do is a really good exam in order to find that out. And even on an apparently healthy animal, an exam is really important for looking for things that might be hidden. And some of the things that we see often that are hidden are ear problems, tooth problems, sometimes problems with weight or being over or underweight, and those sorts of things, lumps and bumps. Those are other things that sometimes people don't notice with their animals. So every veterinarian should do a really good exam with the animals that come in. It's the only way that we can tell what's going on with them. So first of all, I'd like to do kind of a nose to tail exam, just because then I don't forget things and we cover the whole animal. So kind of looking at his nose, it should look like that with really no drainage. And he says, okay, you can leave me alone right now. So always looking at that. Next thing I look at is the teeth. And what I'm looking for, especially in cats, is these things called resorptive lesions, which are actually holes in the teeth which are painful. Peppy does not have those. If they do have them, they tend to paw your hand away like he's doing. Right now he's just doing that because he doesn't want me to mess with his mouth. And if you touch their tooth, a lot of times their jaw will wiggle because it really actually hurts. He does not have any of those problems. That's a good boy. So then the next thing I often do is I look in their ears and look in his ears really fast. Usually I have my assistant helping me, but I didn't want to have another person in the picture, so we're going to try and do this without, if he'll let us. And so what I'm looking at is the outer part of the ear, but mostly the ear canal, all the way actually down to the eardrum, which he's actually really cooperating with me and letting me look at that. So we're looking for dirty ears, looking for lumps or bumps in the ear canal, looking for parasites like ear mites in the ear canal, and that sort of thing. Right now, I'm feeling his lymph nodes, which is really an important part of the exam. Sometimes you can actually catch cancer that way. They can get lymphoma, which is lymph node cancer. You can catch infections that way. Sometimes if they have an infection around the head, they'll have big lymph nodes down here. So then we're going to look at his eyes, always using an ophthalmoscope. And sometimes most cats have much more dilated eyes than Peppy, because he's so used to me, he doesn't care. When they get nervous, their pupils dilate. You can really see their retina pretty well. Looking for eyelid tumors. Looking for anything wrong with the cornea, which is the clear part that they look through. Looking for other problems with the third eyelid and the conjunctiva. And of course, Peppy being a healthy cat, he doesn't have any of those problems. After you've stuck this thing in their ear, they'll a lot of times hold their ear down like that because it's just kind of irritating for them. That's why he's shaking his head, because I've been messing with that. He doesn't, again, he kind of likes the attention, so he doesn't really care what you do to him. Got a stethoscope and listening to his heart, and what you're listening to is his heart rate and rhythm. Cats, interestingly, actually listen to their heart just right in the center of their chest underneath here. And if he has a heart murmur, of course I would tell you that, we'd have to work that up. He's purring, so it's kind of hard to hear. Got a couple of different methods to make him quit purring, but since I already know his heart's really good, we're just going to make him be. So that's good. Now we just kind of feel their body condition, be sure they're not too skinny or too fat. Let's see how they like that. See if they have any pain along in here. That's always a good one to feel for too. Feeling his tummy. You can kind of see me massaging his tummy here. He doesn't really mind it too much. And what I'm feeling for is his liver. If it's big, it'll kind of stick out. If he's got any masses in his abdomen. If he's got gas or fluid in there, which might tell me his tummy's upset. You can feel their left kidney. And sometimes you get lucky enough to feel their right kidney too. And feel his bladder. He's thinking this is kind of the strangest way that anyone's petted him recently. Always kind of look at their rear end, looking for lumps and bumps around their butt, and whether everything here is normal too. And on older animals, oftentimes we'll put a glove on and do a rectal exam, checking for tumors back there, that sort of thing. So that's your kind of your basic exam for a cat, and lucky to say that this one's healthy. And there you go. That's the end of the exam.